because the majority of the residents are in the care homes with dementia, the disease progression could be quite progressive. So you could have a resident who is really well and happy one day, and they go downhill quite quickly within a couple of days. And it was learning how to manage that disease progression, realise the triggers, and work with the nurse in order to improve the resident into becoming well again. As a student, it's quite difficult to stand back and watch residents you've really built up a bond with not feeling too good